Mr. President, 24,000 Montana children's access to health care is on the line today. The House of Representatives is working to pass legislation that reauthorizes a program called the Children's Health Insurance Program. It's better known as CHIP. It's to reauthorize this program for 6 years and to keep the government open, which, if passed, will then come to us for a vote. Why don't we take the opportunity before us to come together on issues we agree on instead of always fighting on what divides us? And I think we can all agree on keeping Montana kids healthy. Let me tell you a story about a family from Helena, Montana, the AG family. Jackson was a normal baby, a happy, healthy baby, until October of 2016 when he was just 8 months old. And that's when he was flown from Helena to Missoula's Community Medical Center's Pediatric Intensive Care Unit. He was deathly ill with a respiratory infection. At that time, it wasn't clear why Jackson got so sick, but his parents soon learned that he had Lay syndrome, a disease in which the body is not able to process energy properly, leading to muscle weakness, swallowing problems, and severe illnesses with just a simple or common cold. His parents quickly learned to manage his new feeding tube, to suction his mouth and his throat, and to put him on oxygen monitors at night. Unfortunately, Jackson has had 5 more serious infections. Each time he's become ill, it's happened so quickly that he's had to have been flown to Missoula, even though he has a team of pediatricians, nurses, dietitians, speech therapists, and physical therapists trying to help him keep from getting ill. As Jackson's mom would say when Jackson gets ill, the only way to keep him from having to be flown to Missoula is to get him seen by his pediatrician as soon as possible, so if he does get sick, it's relatively minor. I can tell you this family in Montana is grateful for healthy Montana kids. That's Montana's CHIP program. They're thankful for providing Jackson's insurance, and they co-pay for his care and his medical supplies. His mom says that the insurance is what makes it possible to manage Jackson's condition and possible to afford well baby checks instead of just going to the doctor on an emergency basis. To add more background to the story, Jackson's dad was disabled in a workplace accident, and he's home caring for Jackson and the family's other 2 children. Jackson's mom works, and her employer has been phenomenal, those are her words, to her as they have faced Jackson's hospitalizations. But the family of 5 couldn't afford Jackson's care without healthy Montana kids. A helicopter bill for the ride from Helena to Missoula alone can be as much as $34,000, and Jackson has taken that flight 6 times. This family doesn't know what they'll do if the funding for CHIP runs out, but they are committed to caring for their son no matter what. Mr. President, that is why I support a 6-year reauthorization of CHIP. Let me provide another reason. This is Danielle. She's 9 years old, and she lives in Deer Lodge, Montana. When she was just 18 months old, she suddenly lost the ability to walk. Now, Cindy and I are parents of 4 children. I can't imagine a more frightening moment as a parent. You have an 18-month-old child, suddenly they lose their ability to walk. Well, she was diagnosed with a form of juvenile arthritis. You don't think about arthritis affecting an 18-month-old child. This is a disease that causes pain, swelling, stiffness of joints, as well as vision problems. Thankfully, Danielle was started on a medication, a twice-a-month injection that controls the swelling and the inflammation. And because of that, she can walk and she can even run again. But these injections are expensive. To pay outright for just 1 month costs over $6,000. And last summer, for 3 months, Danielle was unable to get the injections. She stopped walking. She no longer could go to school. Her mom had to carry her through the house. When Danielle was approved for Montana's CHIP program, she was able to go to the doctor. She got Danielle on another medication, an infusion this time. She's now back at school, running around, to quote Mom, like a kid who doesn't have any problems. Danielle loves to study math and science, and when she grows up, of all things, her dream is to be a doctor for kids. Without CHIP, Danielle's family would be unable to afford the medication she needs. Without CHIP, Danielle wouldn't be walking. Danielle and Jackson and the thousands of other Montana kids and their families need us to work for them. Mr. President, I'm saddened that partisan politics would come in the way of these children's access to health care. We have the opportunity today to reauthorize CHIP for 6 years and avert a government shutdown at the same time. I urge my colleagues to do the right thing here. Do the right thing for the 24,000 Montana kids who use this important program. I urge them to support a 6-year reauthorization of CHIP and to keep the government open. Mr. President, I yield back my time.